what is the best endocrine therapy to use in the first line? Is it aromatase inhibitors, or is it fulvestrant, which has traditionally been used in second line, the estrogen receptor downregulator? And comparative trials for this were hampered by the fact that initially we were not using the appropriate dose of fulvestrant. And when it became clear that the 500 milligram monthly dose was really the more appropriate one, and in fact showed a survival advantage over the 250 milligram dosing, there was a renewed interest in comparing this to aromatase inhibitor therapy. And the recently published Falcon trial directly compared anastrozole to fulvestrant and actually showed a slight superiority of fulvestrant in terms of progression-free survival. In fact, in patients who did not have visceral disease, who had bone-only or soft tissue disease, the outcome was significantly better. Now, the important thing about this study is it was done in patients who had not previously had endocrine therapy, including in the adjuvant setting. So most of the patients were actually de novo, or for some reason or other hadn't had adjuvant therapy initially. So that is one caveat about that trial. But it is now raising the question as to whether fulvestrant should be the partner with some of the biological drugs like cyclin-dependent kinase inhibitors. The Mona Lisa 3 trial that Dr. Ellis will discuss actually looked at fulvestrant and the CDK4/6 inhibitor ribociclib in first or second line therapy, and showed number one that that ribociclib certainly adds to compared to monotherapy, which was the control arm with fulvestrant. But it also showed that in the first line setting, the progression-free survival was very favorable. In fact, it was among the longest progression-free survivals we've seen. Now, of course, there wasn't a head-to-head comparison of fulvestrant to an aromatase inhibitor in this trial. Those trials are ongoing, but it suggests that maybe fulvestrant and CDK4/6 inhibitors may be an optimal first therapy, but I think there's still some controversy there.